Hi everyone, come on in, make yourself comfortable. We'll get started in about a minute and I'll introduce you to Sasha, who you can see on the screen. So make yourself comfortable and we'll get started in about a minute. So I can see a few more people joining. Thanks for coming along. I'm just going to give it another 30 seconds and then we'll kick off. All right, hope everybody's comfortable. We'll get started. So welcome to this month's webinar on what COVID-19 and lockdowns have taught us about health and well-being. I'm really excited today to be joined by Sasha Carey, who you can see there, waving from her office in Melbourne. Sasha's a bundle of energy and a font of wisdom when it comes to health and well-being. So I'm sure you're going to learn a lot from what she has to say, and I'll talk a little bit more about that in a moment. But welcome, Sasha, and thank you for joining us.
Thank you for having me, Jeff, and hi everybody.
So just so that everybody at home know, during today's webinar, you'll be on mute and your video is off, so we can't see you or hear you. We do, however, encourage you to join in and participate by asking questions. You can do that by clicking on the Q&A tab, which is down the bottom of your screen, and you can type in some questions for us. Sasha's also going to encourage some inputs and maybe some emojis, or for you to answer some questions on the way through. So we'd love for you to type in some responses as we go through as well. Most of the time today, we're going to be talking about health and well-being and not financial advice. However, we might touch on some insurance concepts, which is what AIA is primarily known for. So I'm going to provide you with a general advice disclaimer, just to remind you that all that we're discussing today when we do talk about insurance is general advice only. And if you would like to consider how that may impact your own personal situation, get in touch with us and speak to your advisor if you'd like to speak further. So with that, without further ado, I'm going to hand it over to Sasha. So Sasha's official title is Vitality Distribution Manager, but her impact is really about spreading important messages for all of us. And that's why she's here today. And she's going to talk about some fantastic research which AIA have done and some outcomes that we can all take away. So over to you, Sasha.
Thank you so much, Jeff. And as I said before, welcome everyone. It's a pleasure to be in front of your screen from wherever you're joining us today. Today I have the pleasure of talking to you about the mental well-being of Australians. And Jeff and Kate and I were speaking the other day about the fact that we're getting really good now at talking about mental well-being. It's fantastic that we've stripped away a lot of the stigma attached to it. But, you know, we're not quite where we need to be with actually helping people take care of their mental well-being and taking the next step of actually helping them even further when they do present with mental ill health. So today I'm going to spend some time talking about some research that we did last year. It's quite timely, actually. We did a big chunk of the research during that first round of lockdowns. If everyone can remember, it was about a year ago, like this week, I think. So we looked at how we were coping, Australians were coping during that lockdown period. And then I'll spend a little bit of time talking about what we can actually do to help protect the mental well-being of Australians. As I said, there'll be quite a chunk of research that I'll show you, just different elements that affect our mental well-being, things that we can control and things, of course, that are completely outside of our realm of control. We'll spend some time talking about the impact of mental ill health, because it does go quite a lot further than beyond the individual that's suffering with mental ill health. And then we'll look at the way we're stepping up to the challenge. So as I said, we've been doing a very good job for the last few years, really talking and bringing out into the open this issue of mental ill health that so many of us will suffer from at least once in our lifetime. But it's time to actually put a our money where our mouth is, or however you want to say it. It's time that we step up. It's time that we put some action into place, and the way we are really looking at it is, how do we prevent mental ill health, rather than focusing on when someone is really unwell, which is so important and we still need to do. How can we stop them from getting that mental ill health in the first place? So we'll spend some time talking about that as well. As Jeff mentioned, the more questions you ask, the better. This session is delivered for your value, so please spend the time thinking about what this means to you and to the people that you care about, and feel free to use and abuse the chat box as much as you like. Jeff's going to be manning the chat box, so we don't want to keep him awake, we don't want him to fall asleep, so make sure you pummel him with questions or emojis, or however you roll. So let's get into it. As I said, we did a big bulk of research. We were doing some research prior to the first round of lockdowns. I'm situated in Melbourne. I'm not sure where you all are, but we had a few lockdowns. I've lost track of how many we did. So the research I'm going to talk about today is when we went into the Australia-wide lockdown. So that was around March or April. So that's just looking at the information that will come through over the next few slides. Just think about it in that context. So we'll have a look now at what we did, what happened, apart from maybe some little freakouts. What did we actually do? What were the next steps when we went into that initial round of lockdowns? So the number one thing that we looked at to start with was, what are we asking? What are we concerned about? Now we all know, Google is the be all and end all of truth when it comes to asking questions. So that's the place that we looked at to provide us with some insight around what Australians were actually concerned about right now, what they were trying to find answers for themselves. So the top trending information that we were seeking out during this time really related to our health and well-being. How do we take care of ourselves, and how do we take care of the people that we care about? We asked, how can we visit family during coronavirus? Asked how many cases. This was a question that came up very many times throughout the day. People were refreshing this question all the time. How many new cases of coronavirus in Australia? So this gives us a little bit of a sense of control. When we're finding out these pieces of information, we can make it in our minds, see how that fits for us. If the numbers are high but they're in a different location, then that feels okay for us. If they're creeping closer, then what's the next level of control we can place over that to ensure that we're protecting what's important to us. We were also asking if we could go fishing during coronavirus as well. That one was a top trending one. I think golf came into it as well. But all of these things were really looking at, okay, well, these are the things that I've been doing up until I find myself in this situation. What is it that I can still do? What are those go-tos that I rely on to keep myself happy and mentally okay? What can I do now to help ensure that I stay in that space?
That's a funny one, the fishing, isn't it?
It is, yeah, it is. Like I said, golf was also there as well. And I think fishing was one of those grey areas, Jeff. You're not a fisherman, are you? No. Fishing was one of those grey areas, there were a few grey areas, but for a while we weren't able to do that. So for a lot of people, that's their happy space, that's their place that they can go and almost meditate during that time. So
maybe they thought because it was outside and you could do it on your own and you weren't with other people, that was something that you might be able to do. So looking for to play within the rules but do something still a little bit active and outside. That's
right, yeah, 100%. Another question we asked was, how were we moving during that time? So, for many of us, we were confined inside, and that made it really difficult, particularly for those that lived in apartment spaces or didn't have a lot of outdoor open spaces. How were we moving? Those things that I said that were our go-tos to help keep us healthy, our gyms and our outdoor training sessions. Maybe they were group exercise classes, all of those things, all of a sudden, very, very quickly, were taken away from us. So what did that mean? You know, did we all just collapse on the couch for the next 4 weeks and catch up on our Netflix binges, or did we actually look for ways to ensure that we remain physically healthy? So what was really, really great to see, obviously the gym dropped off, that was beyond our control, but there were a lot of searches on online workouts, and great to see that many of the gyms and people who were running exercise classes for Australians actually took their workouts online. So virtually we were able to keep on moving. As you may have heard, but places like Rebel Sport, Kmart, and places that sell exercise equipment completely sold out. The shelves in those areas were just as empty as the toilet paper shelves in Coles. So we were actually really actively seeking out ways that we can remain physically active during this time in whatever space that we had. Online gyms actually said that their membership numbers almost tripled overnight, which was, and you can see that on this slide here as well. The great thing about that is that we know when people engage in physical activity, they're actually 51% more likely to report improved mental well-being and decreased feelings of stress. So we know now from all the research that we've done that there's actually more mental health benefits to exercise than physical health benefits. So of course, for our cardiac rhythms, our fitness levels, all of those type of things, very important to maintain physical movement. But the impact that it has on us mentally actually far outweighs the impact it has on us physically. So it's great that people did actually take that responsibility to see how that they can continue moving. We actually heard as well when we went into that solid lockdown in Melbourne, where we are actually only allowed out for an hour a day to exercise, people actually reported increased levels of movement. They were taking that opportunity to move for a whole hour, and our step count went through the roof. So hopefully that's some healthy habits that we can continue to hold on to moving forward. We also looked at how we were eating during this time as well. Now, there were lots of reports of homemade banana bread, and people mastered the sourdough recipe. I can't say that I was one of those, but I was the very happy recipient of many of my friends who did. But you know, the grocery store inventories are a little bit skewed, obviously, to we have to account for panic buying in those levels. But what we did see actually was an increase in the amount of fresh food bought. We know that people actually spent more money on groceries, but of higher quality groceries as well. We saw a lot more home cooks come out from us, going back to those childhood meals that we loved so much growing up, seeking out recipes to cook those as well. We saw lots of people engaging in their community groups with having cook-offs and recipe sharing, which was fantastic. The outcome of that was it meant that we were 32% of us reported that we ate at least one meal per week from restaurants or takeaway, less than what we did before. So, which is fantastic. A third of us lowering the amount of takeaway or home delivery food that we were eating. We know that if you can cook at home, you are actually healthier. That's the result of being home cooks. We have much more control around what goes into our food. We've got much more control over the quantities we are consuming, and we tend to be kind of reaching more for those fresher food items as well, rather than the highly processed foods. So great to see that we all embraced that home cooking and had a little bit more time to perfect those master recipes. And then, of course, we asked how people were feeling, and this was a big one. So remembering back over the last couple of slides, we actually saw people really working hard to ensure that they physically remained active, and that they also took the next step in ensuring that their nutrition was healthy as well. What we did see, though, that a negative a negative slide was the impact that it had on our stress levels. Now, I'm sure I'm not sort of telling you anything that's going to shock you so much you'll fall off your chair, but we did see, unfortunately, quite high levels of stress that Australians were feeling during this time. We had 50% increase of people reporting stress in their job or work environment. Obviously, job security was a big one. People just were unsure what the landscape of their work environment was going to look like. We saw a 94% increase. I don't know why I laughed then, but it's probably because it's still so raw. I remember the whole homeschooling times, but we saw a 94% increase for those reporting stress when managing home and looking after children. So, you know, I know all too well what it was like sitting at home, trying to work the same I was working before, but having young children. We had a little preppy at home, trying to also make sure that they were being taken care of and homeschooled in a way that we had no idea how to do. So, of course, those levels of stress were huge.
Probably a commensurate increase in respect for teachers experienced at the same time. So, you know, 94% increase in respect and value for teachers around that time as well, I reckon.
Oh, I would say mine tripled that. Yeah, absolutely. I can't thank the teachers enough. Gosh, it's a thankless job, that one, I feel like sometimes. We also saw a 77% increase in family home life and being at home a lot more. But what was one of the most interesting ones was seeing 156% stress increase reported around people's social life. And I've spent a lot of time talking to corporates about this because they're very concerned, obviously, around how their staff are doing working from home. But where we felt it most was the lack of connection that we had. For many of us, our social outlet is actually going to work, and even not being able to see our friends. So that's actually what concerned people the most and really pushed those stress levels up to the highest point across all of the metrics that we measured. Just that lack of social content. This has actually been a concern for many people in the know for a while now, and I believe it's London where they a while ago appointed a minister for loneliness. And quite often now, when new areas are being built and the engineering and architects are brought in to consider it, they actually do bring in an expert to ensure that we have green spaces. We have areas where people can meet and gather. So there's a lot of work going on behind the scenes in that anyway, but never have we felt it more than during this time of lockdown. Previously, we used to always consider that lack of social content and that, contact and that sense of disconnection being felt more heavily in generally the older population. But we're actually seeing quite concerning now that it's coming from the younger generation as well. People aged as young as 12 and 14 are reporting this sense of disconnect. We're also, we've got so many devices now that we can communicate on, but that actual social contact, that physical contact, that being able to see someone in real life, face to face, nothing can replace that. So placing people down into lockdown, this is where we found the highest level of stress. I'll just take a moment there. So that's the research that we've looked at. I'd love for you to let us know how you felt about this. Is this relative to you? Did you do some of these things? Does anyone master any amazing recipes when they were at home? Did you do some online workouts? Does this represent you and your social group or your family life as well? Jeff, I know you did some online workouts.
We did, yeah, absolutely. So just anyone who wants to answer any of those questions, you can put it in the chat box or you can put it in the Q&A tab and I'll sort of pass on the feedback to Sasha as we get those through. Yeah, we did a lot of those things. So we had a MasterChef competition going with some friends. And when we first started that, it was all about, doing it over Zoom. So looking at the presentation, and then the people in the room could taste it, but the people at the other end couldn't. And then we started sneaking up and meeting them on the corner and doing a swap of food to do that. And yeah, we did lots of the online workouts, which was great.
Yep. Wonderful. I know there were some really great things came out of it. I know, you know, we'll be feeling the effects of it for a while, but there were a lot of positives that came out of it as well.
Just got a couple of comments here, which is great. So one from Matt, who said his online workout usage went through the roof, and again, and Catherine saying her husband took up bread baking as a hobby, so she got the benefits of that, which was great.
Yeah.
And another one talking about cook recipes from a grandmother's cookbook.
Oh, amazing. That's wonderful. Dust that off, and oh, that's so great.
Old school.
Fantastic. Well, that's great to hear, guys. Continue filling up the chat box. We'd love to hear what you were doing during that time, what some of the positives were that you took out of that time, and maybe even some of the things that you're really now protective of. One thing that we did with my family, I've got 2 young children, was we sat down every night and ate dinner together and used to play games across the dinner table and things like that. We'd never really done that before because our kids are quite young. And when we came out of lockdown, we said, you know, what do we want to be really protective of and hold on to now that we're out? Every single one of us said that we wanted to make sure that we maintain those family dinners every single night. So and so far so good. I think we're doing that. So yeah, let us know what you've taken out of that time. So now we'll shift from the research and have a look at the impact of ill mental health. And we all have mental health, just like we have physical health, but sometimes our mental health can be poorly. So a lot of the times we do encourage people to change the conversation in the way we talk about mental health, and I will be showing you some things about the impact of ill mental health over the next couple of slides. So we know that there are definitely things that we cannot control when it comes to how we're doing mentally. So we can't control our gender. We know that statistically females do have a higher depression risk than males. We can't control our age. So now, while older individuals in the data set are more likely to be depressed, this can often be explained by non-age features such as stress and comorbidities. So the older we get, the more at risk we are of developing ill mental health. And illness as well, that can come out of left field sometimes. So illness for the individual that's suffering from whatever it is they're suffering from, but also that has an impact on family members or people that care about us as well. So if you're close to someone that is currently going through cancer, you are actually at risk of developing mental ill health. The stress, the impact that has on you is huge. So never underestimate, even though if you're not the individual suffering yourself, you are still at risk. So it's very important, maybe even more important, that you take care of yourself during that time and just be aware that there are some risk factors there. But there are things that we can control, which is fantastic. And these were some of the things that we talked about in the research of those last previous slides. As I mentioned, we can control our exercise levels, and people who do more exercise and do it at a higher intensity have lower risks of depression. So we know that if we walk more than 10,000 steps a day, we can halve our depression rate, which is incredible. So I'll ask a question to you, Jeff, and to the group. Just pop a number in the thousands of how many steps you think the average office worker does every day. I'll give you a clue. It's less than 10,000.
Guess is 6,000, 5,000, 6,000. I reckon 4,000.
Yeah, you're spot on there. So between 3,000 and 4,000 steps a day is what an average office worker will do. And we've all had those days where we get up from the desk, we feel like we've run a marathon, but the only thing we've done is gone to the toilet and grabbed some lunch. So, we do know that just walking has a really, really great impact on our mental health. So if you can aim for that goal every day or at least 5 days a week, that's fantastic. Our sleep patterns actually have a lot to do with how we're feeling mentally as well. There's a very, very small percent of the population, around about 2% of the population, that can actually survive on 4 4 hours a night sleep. Very, very few. Many of us think that we can, but it's definitely not sustainable over a long period of time. So we know that people outside of that 2% who sleep less than 4 hours a night have a 32% higher depression rate than those that sleep 7 or 8 hours consistently. So we're all going to have bad night's sleep every now and again for whatever reason, but if you can consistently aim to get between 7 and 8 hours of sleep a night, then you are actually doing a lot of good for your mental health. Diet is another one. People who consume 3 or more sugary drinks a day increase their risk of depression by 11%, which is just unbelievable, really, when you think about who would have thought that sugary drinks can actually have that type of impact. We know it will have an impact on our physical health, but who would have thought it could have an impact on our mental health as well. For those of us who are gluten intolerant, they have found people who are gluten intolerant and also have depression, they found traces of gluten in our brain. So there's a lot to be said between the gut and brain interaction. You know, the more good food we eat and put into our gut, the healthier our brain is. So, you know, we all know what to stay away from, all the good stuff, right? The sugary, fatty, salty stuff. Fine to indulge in every now and again, but the more pure food that we can eat, the cleaner food, you know, all the food that's kind of around the outside of a grocery store, fresh fruit and vegetables, good cuts of meat, all of those type of things, the better off we are physically as well as mentally. And smoking and alcohol use as well, it's quite a big one. So we know that current and ex-smokers have a 23% higher risk of depression than non-smokers, and alcohol is a big driver towards mental ill health as well. So there are risk factors. So, you know, let's focus on what we can actually control, because it's no point worrying about the things that we can't control. Now, what happens if we don't? What happens if we don't engage in these risk factors that we know that we can control? Despite decades of awareness, statistics are still high. And, you know, I always say you don't need to be a rocket scientist to know what it takes to be healthy. We all know we need to move more. We need to be mindful of the nutrition that we're giving our bodies. We need to sleep well. And we also need to be very mindful of how we're feeling. But despite that, the numbers are still, you know, not where they need to be. So we know that 1 in 5 people will suffer from some type of mental illness at least once in their lifetime. The problem with that as well is not only through that episode that they're suffering, that there's a lot of impact on themselves and on the people that care about them and on society, but they're actually more at risk of developing another mental illness. So if you have one mental illness episode, you're actually at higher risk of developing another one at some point in your life as someone who has never had a mental illness. We know that 1 in 4 people are classified as obese. So that's not just a few extra kilos, they are actually clinically obese. 1 in 5 people have raised blood pressure, and blood pressure is actually one of those asymptomatic illnesses that we have, or conditions that we have. So many of us are walking around with high blood pressure without even knowing it. So these are those who have actually been told by their doctor that they have high blood pressure. Alcohol consumption, 1 in 5 people are still smoking. Alcohol consumption is still really high up there. 12.2 litres of pure alcohol per capita we're consuming at the moment in Australia. Now, I want to focus in on the word pure there. That's pure alcohol. That's not 12.2 bottles of gin a year that we're consuming as individuals. It's actually, if you consider, what's a gin alcohol level? Do you know, Jeff? No, Jeff's
probably 20, 30% maybe.
So if we work on sort of 30%, we're actually, you know, having to times that by 12.2. I've never been good at maths, so hopefully that works out. But you get where I'm coming from. Mm-hmm. And 1 in 7 people over the age of 14 have used illegal drugs in the past 12 months. So, you know, all of these risk factors that are here do actually have an impact on our future state of health, our physical and our mental health. So it's really important that we're mindful of these and what are we doing in our lives to be accountable for these risks, and putting ourselves in a position that we are not at risk of future physical or mental ill health. What does it cost us? So this is just a snapshot from, as Jeff mentioned, I work for AIA Australia, which is a leading insurance company. So we can talk from a statistical claim point of view. So we know that for many years, the top #1 claim payout that we've paid has been in mental health, in the income protection area. So in income protection, consistently, mental health, 32% of females will claim for a mental health condition, and 26% of males will claim for a mental health condition as far as income protection goes. Now, our youngest claimant is around about 19, our oldest claimant is around about 69, but the average age is around about 46. So, and then you can see the other claims underneath. But year on year, that's where we see our highest amount of income protection claims. I think it's also really important to note as well that often mental health is not the first primary claim that people will put in. If people have been off work for injury or illness for a significant amount of time, that claim can actually turn into a mental health claim because of just their lack of connection to their normal life. So the quicker we can get people returned to their normal when they're feeling like they're ready to, the better for our physical, for our mental health. So as I said, we've been doing a lot of talk about mental illness and mental health and all of those within that realm of, how do we take care of our mental well-being? But, we haven't seemed to take the next step. Okay, so what are we doing about it? The research that we've shown actually says that what we need to be focusing on is how do we help people understand what their triggers are, understand risk factors, put control back into their lives and prevent the mental illness happening, rather than the other side of the scale where we're actually treating that mental illness. Still important to treat, absolutely, that's not going away, but how can we prevent people from having a mental illness? If we tell people, if people stop smoking, we know that they're much less at risk of having lung cancer at some point in their life. So how can we do that with mental health? How can we put people in the very best position to prevent them from having a mental illness in the first place? So our research suggests that if the Australian population could practice at least average health habits, so that's, that 10,000 steps a few times a week, good nutrition habits, cutting down on fatty foods and those type of things, we can reduce the incidence of national depression by 4.7%. What that means in numbers is that's 300,000 fewer depression incidences a year, leading to 4.7 million recovered working days and saving the Australian economy around $3 billion a year. So if you've ever had an incidence of depression or know someone that does, how amazing to think that if we can just each of us practice the average health habits, we're not asking people to get up and run a marathon, just asking people to be really mindful of their health habits. If you can just practice at least the average health habits, then you do significantly lower your risk of developing depression or mental illness.
I think it's really interesting putting in numbers like that. Obviously, as a financial advisor, I like to look at the numbers, and that dollar figure jumps out at the bottom. But I think it's a really important point to look at. As you said, you're not asking people to make massive changes. If you can make some small incremental changes often and just bump up a little bit about what you're doing or be a little bit more conscious, then the flow-on effect really builds up, because we talked about on the previous slides the different areas that are impacted and how they can all affect. So if you make some small improvements in those different areas,
absolutely, yeah,
massive long-term benefit to your health.
And Jeff, you and I have spoken many times about it's the small changes that have the largest impact, because they're actually the ones that are sustainable. If we all of a sudden change everything in our lives, clean out the fridge and pantry of all the bad food and say, I'm going to go to the gym 12 times a week, that doesn't last for very long. You know, we very quickly slip back into bad habits. But if we can just, you know, turn the dial slightly each day, those habits actually become quite sustainable over time, which is fantastic, and will have that biggest impact on ourselves physically and mentally. So what we're really talking about here is putting the focus upstream. So what that means is, as I was mentioning before, is we're really looking at how we can prevent mental illness, doing research in big groups of the population to say, okay, let's recognize what some of your triggers may be. Let's recognize that you're at risk because you have some of those non-controllables. So what can we do about the things that we can control? Now, while all types of prevention do have value, the advantage of primary prevention is that, as I said, it is an upstream approach. So it is around that preventing mental ill health before it becomes something that is, you know, quite serious. When we put the upstream approach on, it actually focuses on an outcome across an entire population in a community and emphasizes the range of influences across different sectors in the environment that can impact behavior. So if you're looking at a rural community, for example, you know, what can we do within that community, where the risk factors are? You know, how can we help that community ensure that as a community they are best placed as far as their mental health goes? As I said, this approach doesn't necessarily focus on targeting mental health conditions as such, but instead really focuses on the reduction of risk factors that impact mental health conditions. So such upstream approaches have benefits way beyond mental health, reducing both morbidity and mortality rates. And they actually are a lot more cost effective and efficient. And we've seen this done in other markets in other countries than that kind of post mental illness treatment. So it's a really, really, really great thing to start considering, you know, taking that back step and considering what we can do around prevention.
Just before you move on, Sasha, I've got a question being posed from the audience. So I thought I'd slot that in here now. So the question is phrased, have you noticed if people, e.g. young males or older males, turn off if certain words are used when talking about mental health or mental ill health or anything else? And you know, can we use the term, as he's making a suggestion here, can we use the term fitness, which is a more positive way for the cohort we're targeting? You know, thoughts on that, which I think, you know, coming to that upstream approach, I suppose, is having that conversation before it becomes a mental ill health issue. Is there different ways or different things we can do in talking about or promoting that conversation?
Yeah, absolutely. I love that. And just like we tried to change the conversation around talking about mental health, just the word mental health as itself having a negative connotation, when we all have a level of mental health, just depending on, you know, how healthy or unhealthy it is. So yeah, I love that. And, you know, mental fitness is a fantastic one, and I think would really resonate with most of us, not just that particular demographic. But to that, you know, we have to understand that each individual is different, and looking at different groups of the population, we need to take different approaches with them as well. And that was something similar that you and I were talking about yesterday, Jeff, in the fact that there's a company that has just started a text messaging program. So they have on-site psychologists, and they recognise that men aged around that 45-year-old age group are probably the least likely to go and seek help from a GP or a mental health expert, particularly those in rural areas. But they are happy to engage on their phone in text messages. So, you know, everything from booking in your appointment to having that consultation via text is what this company is doing, and the impact and results that they've had has been incredible. So it really is about, you know, how can we get to everyone, and how can we put that assistance in people's hands in a way that works for them, instead of having that blanket approach. So it's a really good point. Sorry, I missed the name of the person that made it, Jeff. Russell, yeah, thank you, Russell. I love the idea of mental fitness, and I'm totally going to steal that from you now and start using those words instead. It does kind of bring up images of your brain with muscles like that. I love it. That's great. So, you know, why is this? Why are we having this conversation though? And you know, why, going back to a few slides ago, are we still seeing those health metrics that are definitely not where they need to be? And it all comes down really quite simply to behavioural economics. Now, the science itself behind behavioural economics obviously is not simple, but it is just about understanding, and this goes back to Russell's point, just about understanding how people operate, how they think and how they make decisions. And, you know, we don't, as people, although we are all individually wonderful in our own way, we're not perfect, and most of our decisions are not necessarily perfect, and they're not always based on rationality either. So we're quite driven by a lot of things that make up behavioural economics. So it's about understanding that and working with that knowledge rather than pushing against it. So, you know, we've moved a long way away from you have to do this, you should stop doing this, you should do more of that and definitely do less of that. We've moved away from that, and now we're looking at how we can resonate with people by using behavioural economics. So just a couple of examples of that are, you know, we know that particularly Australians, we tend to be quite overconfident and over-optimistic as well. So those things are great when we're following our favourite sporting team. I get to go to my first AFL game in over a year on Sunday, Jeff. Super excited. Following West Coast Eagles, for any Eagles fans out there, I know you'll be cheering along.
Fans on here, Sasha, I'm sorry.
But where overconfidence and optimism doesn't do us any good is when we're considering our own health. So, you know, we all tend to be overconfident about how healthy we are. There's lots of studies that have been shown that even people with 4 or more risk factors indicating that they're likely to have a heart attack within the next 12 months still consider themselves quite healthy. We also tend to be quite over optimistic as well. So, you know, she'll be right, mate, has long since been a catchphrase of all of us, which is great in a lot of instances, but again, not necessarily when it comes to our health. We know, though, that by using things like estimating probabilities, hyperbolic discounting, financial incentives, and particularly the nudge theory is really what works with people. So there's been lots of studies done that shows that if we can just nudge people in the right direction, if we just present some good options for them and then nudge them in that direction, they're more likely to go in that direction rather than, you know, not giving them any options at all and just telling them what they have to do. So lots of studies done in that instance. You may have seen it's a YouTube clip, I believe, where there was steps going up to a gym, actually, and next to it was an escalator, which is just really funny. It always strikes me as being quite funny that there's a gym at the top, and pretty much 90%, I'm not going to get that number right, but it was like most people would take the escalator up to the gym. So they painted piano keys on the steps next to it just as an experiment, and they lit up as you walk up the steps. And what that actually did was encourage more people to walk up the steps. So, you know, that option was always there before, but, you know, people tend to take that easier, quicker option. But when you can make it fun, when you can nudge people in the direction that they feel will enhance their lives or that moment, they're more likely to go in that direction. So that's what we're really, you know, focusing on, working with behavioural economics, working with the fact that we know that people aren't rational, and just helping them make decisions that feel good to them, but is moving them in the direction of good health and well-being. And that's really where the Vitality Wellness Program really comes into it. So I know a lot of Jeff's clients and Jeff himself. What status are you at now, Jeff, on the Vitality Program?
I achieved platinum status last year. I'm at gold at the moment, but I think I'm going to be pushing it a little bit to get to platinum this year. I'm trying really hard, but I might just miss my platinum this year. So.
Oh, you'll get there. I have every faith in you that you'll get there. So Jeff and myself and many of Jeff's clients belong to the largest the world's largest health and wellbeing program, the Vitality program. It's been running for over 26 years now, and it is driven by behavioural economics, which is why it's so successful. It provides a wellness solution that helps millions of people around the world get healthier, and it does that by giving them all the tools, knowledge, resources, incentives, all the good stuff to actually improve their health. So we start off by helping people have a good understanding about their health, currently where they are right now. Then we provide them everything that they need just to make those small incremental changes that we talked about before, nudge them in the direction of choosing healthier habits and creating healthier habits, and then we reward them by doing so. And of course, the gift that comes with purchase is they are happier and healthier physically and mentally, without them even realizing it, which is fantastic. Obviously, the program, as I talked about, is based on behavioural science, and everything that goes into the program has been proven to work. So there's a lot of clinical research that goes into ensuring that if we incentivize someone to do something, it's for a reason. We know that if we can incentivize people to walk 10,000 steps a day, that's going to improve their physical and mental well-being. So that's a big part of the program. Vitality has significantly and scientifically proven that members who actively engage in the program do actually live longer and have lower healthcare costs than non-Vitality members. So we know that if people do develop an illness, they'll spend less time in hospital and spend less on healthcare costs than someone that's not part of the Vitality program. As I said, it guides, incentivizes and provides members with an access to a broad range of wellness and prevention pathways that are the most up to date. So, you know, we've moved away from, as I said, that kind of hitting people over the head, do this, do that, you're not doing enough of this. It provides the most up-to-date data that we have, and just encourages people to, you know, more often than not every day because we're human, but more often than not, make the decisions that are going to have the best outcome for us mentally and physically. So that's a big part of what we're doing. And that brings me to the end of the presentation, right on time, I believe, which is amazing. I never finish on time, as you know, Jeff.
Always had faith in you. Yeah, I mean, just echoing Sasha's thoughts on the Vitality program, I certainly think one of the key benefits is you always, you get what you focus on. So Vitality is just there as a small reminder of the positive things that you can do, and the, you know, relates to all of the different risk factors and areas that we can improve, and makes you think about those, and gives you some tips and some incentives to do the right things in those areas. And certainly has been helpful for me, and I've enjoyed being part of the program. A lot of our team here and a lot of our clients who are on the call today are part of it as well. Typically, it's linked to insurance, so it also has benefits of reducing your life insurance premiums or health insurance premiums. So if anyone has health insurance or life insurance, then, you know, having a product like Vitality linked to it can be a great benefit. So. So as Sasha's put up on the screen there, we are sort of right on time, but if anyone has any questions or final comments, we'd love to take those. So type quickly in the chat box and we can get to those. Otherwise we'll wrap up. But I'm sure everybody has found that very helpful. And if you do think of questions afterwards, send them through to me or to your Evalesco contact, and we can get those on to Sasha, or we can get back to you with some responses to those as well.
Absolutely.
There's nothing coming through at the moment. So Sasha, thank you so much for your time and sharing the research and your wisdom as well. I think there were some fantastic insights that I took out of the research, and I think it was a really timely reminder, given, as you said, it was 12 months ago that we went into lockdown and all of these issues started to come to fruition, I suppose. So it's really timely reminder to think about where we were only 12 months ago, and hopefully we can continue to pick up some of the habits we've identified, look at better ways to, as you said, go upstream to improve what we're doing from a mental ill health viewpoint. So thanks again for your time.
No problem at all. Thank you for having me on board, and absolutely more than happy to answer questions down the track if you think of one. So shoot them through to the team at Evalesco and I'll do my best to answer them. But thank you for having me, and have a wonderful Thursday. What's left of it, everyone.
Thanks, Sasha. Yeah, and thank you very much, everybody, for your time and your engagement through today's session. And we look forward to catching up again soon. Thanks. Bye.
Thanks, guys. Bye-bye.